First patient to test positive in Midland County succumbed to the disease on Tuesday. Officials say his case was travel related, although we're told he had no significant underlying health conditions. Officials say that he was 60 and his age was against him. Midland officials also confirming 2 new cases of COVID-19 in the county. And the first man, a man in his 60s with also no underlying health conditions. The other patient is a child, and we're told this case is related to travel within the U.S. The child is currently quarantined at home. 2 patients from Lee and Crane County are also in self-isolation. That brings the total number of coronavirus cases in West Texas to 5. And after county officials are releasing an update on their testing numbers, so far they know as 35 people have been tested for COVID-19. 14 tests came back negative and 21 tests are still pending. We will continue to keep you updated. And in Andrews, according to the Public Health Department, there are currently no confirmed cases in the county. 8 tests have been performed, 3 have come back negative, and 5 test results are still pending. The department is currently monitoring 11 people twice each day who are showing symptoms. Those 11 people have either not been tested or waiting on results. Officials do encourage residents in Andrews County, if they are showing any symptoms, to call the health department for further instructions. And the mayor of Fort Stockton issued a state of disaster last night. This opens up more funding to the city amid the pandemic. Among the regulations, the city is now under a curfew. No resident will be allowed to walk or drive around the city from 10 p.m. to 6 a.m. without the exception of going and coming from work. In Dallas-Fort Worth, Waco, San Antonio, and Austin are just some of the cities that have some sort of shelter-in-place set for their counties. But Midland Mayor Patrick Payton says it's unlikely that Midland County will follow suit. Bay 2's Police Romero explains his decision.
If you don't want to be told what to do, then do what is being asked of you at this particular time. If you have not thought this is serious, then it's time for you to understand that this is incredibly serious. It is right here in Midland, Texas.
The coronavirus continues to spread rapidly, and many local leaders are placing their counties under a shelter-in-place. The Midland mayor stating Tuesday that a shelter-in-place is not needed in Midland County.
And at the very front of them, they tell you we're going to shelter in place. But then when you get to about page 3, 4, 5, 6, 7, or 8, there are all the exceptions of what it means to shelter in place, all the things that are defined as essential businesses and all the things that are non-essential businesses. Our people are already doing what's being asked of people to shelter in place in particular regions.
The mayor adding that every resident in Midland is responsible for holding themselves accountable during this time. And although it isn't mandated to shelter in place, it is in the best interest to do so.
Just to be clear, we're asking you to shelter in place. We're not telling you to shelter in place. Our freedom comes with responsibility. Be responsible in this particular situation to everyone around you.
Feliz Romero, Big 2 News.
And the mayor also says that they are still waiting on around 100 tests to come back, and we will keep you updated as those cases develop. And cases across Texas are rising today. There have been now 13 deaths across our state from the coronavirus. Right now, there are 1,027 cases, according to Johns Hopkins University. That number includes confirmed cases as well as presumptive positives. And as federal lawmakers debate how and when states will get another refund of money to respond to COVID-19, Texas is asserting its trademark independence for now, turning to private companies to deliver supplies for the state. Big 2's Wes Rappaport has more.
I am proud to say that we are loaded with a lot of equipment.
To meet the growing demand for supplies, the private sector is stepping up with masks, gloves, gowns, and other personal protective equipment. Abbott says his new supply chain task force, established Sunday, has already placed an order for more than $80 million worth of equipment.
Altogether, next week, Texas should be getting more than 1 million masks per week.
Despite increasing calls to issue a statewide stay-at-home order, Abbott again deferred to local leaders to make their moves, but he didn't take it off the table entirely.
Candidly, if you look at these stay-at-home orders, they're fairly consistent with my executive order, with one exception. My executive order allows people to gather in groups of no more than 10. But basically, my executive order is one where people should be staying at home, practicing good distancing behavior, and only essential type services in operation. On my travel to this location today, I was surprised at how many vehicles I saw on the road. It's clear to me that we may not be achieving the level of compliance that is needed. That's why I've said before, I remain flexible in my statewide standard, and I look at data multiple times a day. I get advice from the medical profession multiple times a day, and we will continue to evaluate based upon all the data whether or not there needs to be heightened standard and stricter enforcement.
Wes Rappaport, Big 2 News.
And anyone interested in donating supplies or volunteering time is encouraged to visit texas.gov. There is a section to select what resources you can provide. And while many are practicing social distancing, hospital officials say now it's your turn to help the community and slow the spread of COVID-19.
Same things we've been telling people for several days now. Stay home. Whether you have symptoms or not. This is the time when we have the opportunity to stop this virus, to slow its spread, but we're going to do so by staying home, by social distancing, by very careful hand hygiene, washing your hands for 20 seconds on a regular basis, trying not to touch your face, doing everything that we can to minimize the spread of the disease.
And the faces of the victims of this virus, many of them are young, previously healthy people, including a teenager who may have died from the virus and a former lacrosse star now fighting for his life. ABC's Kenneth Moten has the story.
This morning, a family in New Jersey is praying their 25-year-old son survives the coronavirus.
This virus is really dangerous. He's very, very sick.
Jack Allard is now in a medically induced coma and has been on a ventilator for 1 week. His mother says the former college lacrosse player has no pre-existing medical conditions.
He never vaped. They were asking us that. He never vaped. He never smoked. I mean, he took his health very seriously. I mean, he's an athlete.
Allard is a new example proving that young people are vulnerable to this virus. In New York City, 46% of all 15,000 coronavirus cases are people aged 18 to 44.
I think people think of this as an old person's disease. It's not.
Los Angeles County is reporting the youngest American to possibly die from COVID-19. Officials say the patient was a healthy teenager who tested positive, adding the case is complex and there may be an alternate explanation for the death. We're also learning about the healthcare workers sacrificing their lives, like 39-year-old Natasha Ott, who worked at a clinic in Louisiana. She started feeling sick 2 weeks ago. At the time, she decided not to take one of the precious 5 tests her clinic had left for the coronavirus. She finally took one when her condition deteriorated, but she died waiting for the results. Meanwhile, in Washington state, one young man is sharing his survival story. Last month, Matthew Robertson was a healthy 28-year-old. Today, he's doing physical therapy, trying to regain his strength after battling the coronavirus.
I know a lot of people are still kind of in that belief that, oh, I'm young and healthy, therefore it probably won't have a profound effect on me. But I mean, obviously from my case, it just, and probably other people's cases too, it just kind of proves that kind of mentality isn't always true.
Kenneth Moten, ABC News, New York.
Local officials say that if you are showing symptoms of COVID-19, which include fever, cough, tiredness, difficulty breathing, call 68-NURSE for further instructions. It's a free medical advice hotline that can screen you for the virus. Midland health officials saying wait times are longer than normal, so please be patient and keep trying the hotline.